Hepatitis A is a communicable disease that spreads from person to person. It is spread almost exclusively through fecal-oral contact, generally from person to person or via contaminated food or water. Contaminated food is a common mode of transmission for hepatitis A, and outbreaks have been traced to foods contaminated by infected workers, as well as fresh foods such as strawberries and green onions that were contaminated before entering the establishments that served them. Hepatitis A is one of 5 human hepatitis viruses, A, B, C, D, and E, that primarily infect the liver and cause illness. An estimated 80,000 cases occur each year in the United States, and an estimated 100 persons die each year as a result of acute liver failure due to hepatitis A. But the rate of infection has dramatically decreased since hepatitis A vaccine was licensed and became available in the U.S. in 1995. In outbreaks traced to food contamination by infected workers, food preparers or cooks have often been identified as the source of contamination, although they are generally not ill at the time of food preparation. The peak time of infectivity, when the most virus is present in the stool of an infectious individual, is during the 2 weeks before the symptoms begin. The virus belongs to the family Picornaviridae, as do polio, echo, and Coxsackie virus. Each of these have single-stranded RNA genomes. The incubation period for infectious hepatitis ranges from 15 to 45 days, and lifetime immunity usually occurs after an attack. Prior to the 1990s, there were more documented outbreaks of hepatitis A traced to foods than any other viral infection. The largest foodborne outbreak of hepatitis A ever recorded in the United States occurred in November of 2003. There were 600 victims with 3 deaths. The vehicle food was imported green onions served by a fast food restaurant chain. Between 1992 and 2001, an estimated 23,000 cases of hepatitis were reported to the CDC. In 2001, an outbreak of greater than 46 cases occurred in Massachusetts, and it was associated with the consumption of sandwiches, which apparently were contaminated by a food handler. In 1988, there was a community-wide outbreak of hepatitis A in a religious community along the border of Utah and Arizona. Between July 1st and May 30th of the next year, 204 cases occurred among 3,500 residents. This extensive outbreak provided an opportunity to assess the effect of mass administration of a vaccine on the course of the outbreak. It was an important preliminary study on the implementation of the hepatitis A vaccine. Despite rapid scientific progress in understanding the biology of viral illnesses, viral liver disease remains a common and challenging problem for physicians and their patients. 5 viruses designated hepatitis A, B, C, D, and E primarily target the liver and produce inflammation or hepatitis as their primary clinical manifestation. The liver is a vital organ located in the upper right-hand side of the abdomen. It performs many functions in the body, including processing the body's nutrients, manufacturing bile to help digest fats, synthesizing many important proteins, regulating blood clotting, and breaking down potentially toxic substances into ones that the body can use or excrete. Inflammation may, in severe cases, interfere with these processes and allow potentially toxic substances to accumulate. Following ingestion, hepatitis A enters the bloodstream through the epithelium of the intestine. The blood then carries the virus to its target, the liver. All forms of hepatitis contain RNA as genetic materials in its core, which is surrounded by a fatty envelope called a capsid. The virus enters the body, circulates in the bloodstream, and attaches to liver cells. Once attached, the virus releases RNA into healthy cells. The viral RNA then replicates itself hundreds or thousands of times, making genetic material to produce new viruses. These new viruses, virions, infect other cells or are excreted into the bile and released in stool. Eventually, this process can shut down the functions of the liver. Symptoms of hepatitis include jaundice, mild fever, muscle and joint ache, nausea, vomiting, loss of appetite, and abdominal pain. The incidence for hepatitis A is approximately 1 in 8,500, or 0.01%, or 32,000 people in the United States. That is 32,000 people per year, 2,666 per month, 615 per week, 87 per day, or 3 per hour. 32 to 38% of our population in the U.S. have a history of hepatitis A. As with any disease, there are always more cases than have been reported to the authorities. In the past few years, there has been a steady decrease in cases reported, which correlates to a decrease in estimated clinical cases, as well as a decrease in the estimated number of new infections. The number of cases has taken a steep drop since the implementation of the hepatitis A vaccine in 1995. Historically, in the United States, certain populations are at an increased risk for hepatitis A disease. Namely, Native Americans, Hispanic Americans, Alaska Natives, migrant populations, and certain religious groups have had higher incidence of hepatitis A in past decades. Some of these rates are now decreasing as a result of hepatitis A vaccination programs. From 1987 to 1997, Utah was among 11 mostly western states that accounted for 50% of all reported hepatitis A infections, but only 22% of the population. Since 1996, the number of cases reported in Utah has steadily declined. Communities with high rates of hepatitis A typically have epidemics every 5 to 10 years that can last for several years. Hepatitis A vaccine was licensed in 1995 for use in persons over 2 years of age and provides long-term protection against hepatitis A infection. Hepatitis A vaccination is now required for school entry in Utah. Hepatitis A virus is excreted in feces of infected people and can produce clinical disease when susceptible individuals consume contaminated water or foods. Cold cuts and sandwiches, fruits and fruit juices, milk and milk products, vegetables, salads, shellfish, and ice drinks are commonly implicated in outbreaks. Water, shellfish, and salads are the most frequent sources. Contamination of foods by infected workers in food processing plants and restaurants is common. A great way to stop the spread of hepatitis A is by educating the public about proper sanitation and personal hygiene with special emphasis on careful hand washing and sanitary disposal of feces, specifically at daycares. Although daycare centers can be the sources of outbreaks of hepatitis A in some cases, disease within those centers commonly reflects extended transmission in the community. Secondly, we can provide proper water treatment and distribution systems as well as sewage disposal. This is generally only a problem in developing countries. There are at least 4 inactivated vaccines on the market, all in line with the World Health Organization recommendations. According to a study done by Averhoff et al., hepatitis A vaccine is highly effective in preventing disease among endemic populations. Childhood vaccination appears to have greatly decreased hepatitis A incidence among children and adults, and controlled the disease in communities where there are recurrent epidemics. Raw oysters, clams, and other shellfish are risky for a variety of infections, including hepatitis, and should only be consumed if it can be ascertained that they are from a non-contaminated area. Otherwise, all such items should be heated to a temperature of 85 to 90 degrees Celsius for 4 minutes, or steamed for 90 seconds before eating. In endemic areas, travelers should take only hot or bottled beverages and hot, well-cooked food. It is important to remember that all people who ingest the virus and are immunologically unprotected are susceptible to infection. Disease, however, is more common in adults than children. It is the responsibility of the healthcare professionals, hospitals, laboratories, Department of Corrections, and local health jurisdictions to report any cases of hepatitis A to their state Department of Health. Take enteric precautions during the first 2 weeks of illness. Hepatitis A is a potential problem in large collections of susceptible people with overcrowding, inadequate sanitation, and water supplies. If cases occur, increased efforts should be exerted to improve the sanitation and safety of the water supplies. In conclusion, the main things we need to remember about hepatitis A include that this virus is spread mainly through the fecal-oral route. It is communicable 2 weeks before the symptoms occur, which greatly helps the spread. The vaccine has caused a drastic decrease in cases in the United States. The best way to prevent the spread is through utilizing personal hygiene techniques like remembering to wash your hands.